At Southwest Missouri Area Health Education Center, our mission is to increase access to healthcare by increasing the number of students who go into healthcare professions. And we kind of do that through a couple different ways, but one of our main ways of doing that is through youth recruitment pipeline education programs. We have what's called an ACEs club, which is kind of an elite club of high school students. They have to apply, interview, and be accepted into this program.
So the ACEs program itself is a 2-year program. It's designed to help students that want to already go into health careers. So they've made some kind of decision that they like science, they like the health sciences, they can see themselves in a health career down the road. And we kind of just support and direct them and help them get their foot in the door into the programs that they're interested in. It is a competitive program, so they have to have at least a 3.0 GPA, 2 references, letters of reference, and they have to complete a full application. And then we go through an interview process. After that, the students that are accepted go through an orientation, and then they start into their different trainings throughout the year.
As an ACEs student, I have received experiences that are not offered in a typical classroom. So we get to practice sutures and get certified in CPR for free. This program really helps students connect with places that they would never have dreamed of before.
What we've noticed in the more rural areas that we serve is the transportation issues for students that live in those areas. So we've started taking the workshops that we teach in our ACEs program, and we're taking them on the road, working with our science and health teachers, bringing those workshops into the classroom and introducing those students to a variety of healthcare careers that they might not otherwise get an exposure to and have that opportunity. It's been a very successful program. We've seen a significant increase in interest from students who would not otherwise have been exposed to those career opportunities.
I think it was AHEC's mission statement that really interested me in becoming a part of the program. I mainly look over the clinical things at AHEC. Southwest Missouri has gained popularity among students over the past few years because we are a preceptor-based course site, and our medical students get a varied experience at different healthcare facilities in the region.
One of the things that we do is we actually coordinate with disaster preparedness programs, and we work with several partners, including Cox College and Mercy SBU, and also Mercy Springfield.
And then we also have MASH camps in the summertime, and those are for middle school to high school students, 3 to 4 days, usually in the summertime. Usually takes place at a hospital, and they will get some in-depth conversations from healthcare professionals in the hospital. They'll see tours of the hospital, do some really cool things during those few days.
Like, you can't put your hand down because it like forces your hand back. Yep, see.
Well, with AHEC, we are, an excellent resource for those who are, interested in going into health careers. One of the most rewarding things for me being at AHEC is to see the students come back as health professionals and ask how they can get back to us.
Our programs are a very adaptable resource. We're able to adjust our programming to fit specific educational and training needs.
If you're a student looking for a career in healthcare, or already a medical student looking for clinical experience in Southwest region, we have all the resources that you need, and we are happy to show you around and show you all the possibilities there are for you.
Out, out, in, instrument not. Out, out, in, instrument not.
Perfect.
Out, in.
Okay, just cut the rest.
Yeah, okay.